but there's this test, it's called the Oncotype test, and that is what we use to help us determine in a lot of borderline cases which women need chemotherapy. And it's used on someone who's estrogen receptor positive and has no lymph node involvement with their breast cancer, which is a pretty big majority of breast cancer cases. It looks at the actual gene makeup of the cancer cells in your breast. So those breast cancer cells, not your own personal gene makeup, but the cancer cells gene makeup. And it looks to see how high risk it is for recurrence. And they've got it down to like a specific number for who needs chemotherapy, depending on how high risk your cancer is for recurrence. And so it's really cool. And there's targeted treatments. So it's growing a lot, and lots more, I think, science and improvements to come. Radiation therapy. This is one of my last couple of slides here. I'm rounding the bend. So radiation therapy, and I'm showing this with brain because I wanted to bring up a point, and this was kind of the best picture I could find for it. But radiation therapy, like I was saying, is given to women that have had the breast conserving surgery. So those are like a lumpectomy or a partial mastectomy. Then radiation is always recommended for these women as long as they're under 70. So, and it's to decrease the risk for local recurrence. So you get radiation therapy to reduce your risk of breast cancer recurrence in your breast. And it's focused and targeted to your breast. And on this last kind of comment there is that it's there's a lot of advancements in this field, and so that there's less toxicity, because with radiation therapy you can get really bad skin burns, and people worry about injury to your heart or to your lungs, especially on the left side. And if you see these pictures here, the top one, you can see that beam, it goes all the way through the head, and that's sort of some of the more traditional type of radiation therapy. And then if you look on the bottom one, you see that more, the beam that stops, and they can actually target the beam and how deep they want the radiation therapy to go. So they can designate the depth with the radiation therapy, and that's proton therapy, which is sort of a move in the treatment of radiation for breast cancer. And so we're moving in that direction. I think that's pretty exciting.
Yeah. Cutting edge.
Yes. So that pretty much wraps it up. What do you guys think? You got any questions? There's so much more nitty gritty we could get into because it gets so individualized, and I just wasn't sure how much to break it down.
I think this high-level overview is excellent. It brought back a lot of memories about when I went through treatment. I know when just the first diagnosis or the first indicator that, hey, you have cancer, it was just a whirlwind, multiple mammograms, the MRIs, the ultrasounds, the CAT scans, the multiple biopsies. It's very intense. But for you, how long do you stick around after the diagnosis is made?
Well, I see people in follow-up for 5 years after diagnosis, typically. And so we try to make it so it's once a year that we'll see them at the time of their imaging, as you kind of get further out. And I tell a lot of people that because it's a really good point, that it's so overwhelming at first with diagnosis. And they're like, I have a life. Like, I can't come in here every day and get my genetic testing, get my MRI, then come back and get a CT and a bone scan. And wait a second, now you want me to get another ultrasound and another biopsy? Like, it can definitely get that way prior to your first treatment, and it can be so overwhelming. And so we try to let people know that we want to make sure we're fully informed before we begin any kind of treatment, and then we try to stay out of there, try to keep them out of visits to the doctor after that. But yeah, so I follow people about 5 years after, between me and my collaborating physician, Dr. Joseph. She's a surgical oncologist and does a lot of our breast cancer surgeries at MetroHealth. And between her and I, we'll see a lot of women through follow-up for the first 5 years.
We got a comment on Facebook. Someone said this is very good information. So thank you so much for sharing this.
Yeah.
At the beginning, you spoke about, making sure that you make the best decision for you. So I know when I first was diagnosed and I had to figure out whether I was going to do a lumpectomy, mastectomy, double mastectomy. Oh, geez. It's like, how do you really know what's the best decision, but I can say that, you and a lot of providers like you provide a lot of information to help you make the right choice. So any of our listeners, just be transparent with, your doctor or your nurse practitioner, telling them about your lifestyle, because this change that you make or this choice that you make, it becomes you, and you have to make the best one for you. Yeah.
That's such a good point. And also too, one thing that I see a lot after women have reconstruction, it doesn't always look as beautiful as those pictures. And then they feel guilty that they don't like the cosmetic outlook of, the way it looks cosmetically. But at the same time, they are a breast cancer survivor. And sometimes it breaks my heart that feeling of guilt that they'll have like, I feel so bad. I don't like the way this looks, but I feel like I should be happy because I made it through breast cancer. And it's okay, and I think it's okay to not be happy with the way it looks and to go back and try to get things fixed or balanced. I mean, I see that a lot. I almost, one woman was asking if she could have grief counseling, because she was grieving the loss of her breast. She said, this was my best feature. My breasts were my best feature. And she's like, I didn't actually really realize that until it was gone, that I was so proud of my breasts. I liked it better than my smile, my eyes, and it's such a, it's the way you look at yourself in the mirror every day. And so it's a really important decision and a hard one. It's hard. It can be hard to make.
Definitely. I shared with you earlier, I was never a girly girl. Mm-hmm. And I didn't realize how much of a woman I was until I lost one of my breasts. I just didn't feel right. So,
yeah,
some people may think it's vanity. No, this is you. It's tough. It's tough. It's very tough. But technology, medicine has advanced, and I appreciate you sharing the pictures from the 1970s, because it does not look anything like that now, yeah, if I would have saw that picture, I probably would have just, hey, I'll take my chances with breast cancer. And to speak to that, a lot of the clients that we serve, we all do research online, and we look at all these pictures and say, oh no, I'm not going to do this. I'm going to look like this. But we try to encourage everyone. I've sent people snapshots of my boobs. There were a lot. It doesn't come out like that anymore. There's hope.
Yeah. It's so true. Or they'll say my grandma had a mastectomy, and they'll remember taking care of their grandma after that, and they will absolutely, be filled with fear. And so there has been so much advancement in that. And so there's that struggle. It's real. Yeah.
The technology has come a long way. We even have prosthetics now. So, hey, get tattooing. Still bring that feminine womanhood back. And it was one question I wanted to ask you, and I was writing notes while you were talking, and I can't find it. Lavada, you have any questions?
No, I'm good, but I guess I would just make a comment to go along the lines with what you guys were saying. We never know. Everything is individualized. What defines us as a woman, or what we feel makes us a woman, is different for each of us. I'm in the office every day with women, and I'm doing a lot of education and family planning with them, and birth control management. And some of them, they just have to have a menstrual cycle to feel like they're a woman. And they'll say, well, I don't want birth control that's going to make me not have a monthly cycle, because that's how they feel like they're a woman, to have that monthly cycle. Power to them. I don't want that for me. I'd rather forego that. But you just have to realize what defines womanhood for each woman. So whether it's their breasts, or whether it's a monthly cycle, or whatever it may be for each individual woman, you have to appreciate that for that person and try to preserve that, because we never know when we don't have that body image disturbance, or how that can affect them mentally and make them feel less than.
That's absolutely right. You don't know, what makes you feel like a woman, and but it's really vital. It's important um, to understand that and speak it, and speak up about it.
Right.
Oftentimes out here, I think I speak to multiple women through my sister's Keeper, and the way they would describe themselves as an alien, to that. You're walking around with one boob, or maybe one, or a lump in your chest that wasn't there before. You lost your hair, you lost your eyebrows, and you just lose a piece of yourself, and the inside that is gone. So it's a battle. It is tough. It's tough. Yeah, but we try to help as many as we can, because you can't do it by yourself. And we just, all the work that you do in. And I finally found the question, and I have two actually. So I was diagnosed with breast cancer at the age of 32. So, my girls they'll be 15 on the 10th. So their directive is, when you're 22, make sure you start screening for mammograms. Make sure you know your boobs now and track the changes. So one day, my oldest twin, just by a minute,
I like that.
had a lump under her arm, and she was scared because she thought it was. But it was actually, we changed her deodorant, and so I knew it was that. But is there a telltale signal? Because I think we all do this, especially our deodorants. How do you know, hey, this is something I need to go to the doctor and be screened for, or this is nothing? So is there a kind of balance to know when to go to get a check?
Yeah, I like that question. Okay. So superficial. Do you know what that means? Like right up in the skin and that dermal layer, that's something, especially if you're talking about in your armpit or your axilla and you feel a lump or a mass in your armpit. If it's superficial and really like in the layers of your skin, you can be less concerned about that. You can also be less concerned about like a tender lump, something that's tender and or something that you notice around your menstrual cycle, and then it fades away as your menstrual cycle passes, or you notice it as a kind of a cyclic thing, less concerning. If you have a history of, sebaceous cysts or things like that forming, that's another, it's a really common finding. Lipomas or sebaceous cysts or abscesses are pretty common findings in your armpit, as well as like little fibroadenomas and also accessory breast tissue. Even in, it's not like you've got this huge fatty lump in your breast, but you can sometimes have that tenderness or pain in your breast, and it can be just sort of some accessory tissue. But most of those things are associated with a tenderness that's either cyclic or a tenderness that improves with warm compresses. Something that seems to persist or is non-tender, those would be the things you would want to come in for. Is that helpful?
Yeah. So when Anna was saying like the cysts, or when you constantly get those cysts or those sebaceous things, so she's kind of referring to what we commonly call or refer to as boils under our arms, like when grandma or auntie have those boils. Then we try to do those warm compress like 3 to 4 times a day to see if they will come to a head, if you will. And if they don't, or like Anna said, they persist, then we definitely want to follow up for those and make sure that that's what it was.
Good response. Thank you both. Another question I have for you: what does screening look like in the new age of COVID?
You know, so it looks like masks and temperature checks and not coming in if you're sick, and postponing, you know. We, for about 2 weeks, we completely shut down, and we weren't doing screening mammograms. We were only doing mammograms or ultrasounds on people that actually had palpable concern. So there was kind of a quiet period there for about 2 weeks, but otherwise we kicked right back up, and it's just checking at the door and wearing your mask. And when you sit in the little gowned waiting area, everybody has to sit 6 feet apart. Otherwise, we're trying to keep up with all the screening, because I mean, what a terrible outcome to, like, you know, just another problem with COVID, you know, is to be missing people that need screenings. And I'm actually quite concerned about that, you know. So come in and get your screening mammogram, wear your mask and come in. It's so important. It's so important. Don't be scared. Come in. So
we know the mobile mammogram unit. Are you a part of that team?
Yeah. Yep. So we'll come to you.
And so on the clinic side, because again, I'm preventative care in the hospital. We're in the clinic, outpatient clinic. So we're still accepting patients for their annual well woman exam. So still make your appointments, and then we get you over for your screening exams. Again, we ask that if you are having symptoms, or you are sick or believe that you do have COVID or tested positive, do not come or wait your 14-day period, and have been in isolation. But other than that, please come to your appointments, and I will definitely write your order to set up your appointment for your screening mammogram. Or if you need to go to the breast clinic, I will give you your referral to see Anna. And we'll go from there, and depend upon your results, you know, you'll go through the process thereafter. But we definitely do emphasize that you still need to come and have your annual checkup, so that we could definitely take care of that and do preventative medicine, because again, screening does, early detection does save lives.
Well said.
Well said.
Cool. Well, Anna, how do we reach you? So any of our listeners, anyone who's watching us, we've had a suspicious lump in our breast. How can we find you? How do we reach out and make an appointment with you?
Well, there's lots of different ways. Probably the easiest way is to just get online, and you go to the MetroHealth Breast Center, and there's just one number there, and you tell them you want to come in and see Anna, the nurse practitioner. Or you can just say Anna, they'll know who you're talking about. But Anna Persis is my first and last name, and I'll be happy to help you out with any problems. So
Excellent. We'll track you down.
Yeah. Do you want me to rattle off the phone number?
Yes.
Okay. It's 216-957-2778 is the phone number to call. So and ask for an appointment with Anna.
Right,
Thank
excellent.
you. Yeah.
This has been an honor and a treat, and we are looking forward to having you back along with Ms. Lavada Tilley and talking about preventative. We're going to talk about prevention and ways to avoid diagnosis, correct?
Yeah. Yes. Lifestyle changes. I think Lavada and I would have a lot of fun doing that together, kind of working on some preventative breast cancer strategies, and some really easy things and some harder things, but just working together on that, and kind of giving you further education. We'd love that.
Yes, that'd be awesome.
Yes. Just let me know when you're free. We'll love to have you back. This has been awesome.
Yeah, been a joy. I love working with Anna and patients.
Well, I think that the whole mission for My Sister's Keeper is awesome, and I just know so many women that would benefit from you guys, and I'm really excited to keep spreading the word about My Sister's Keeper and get people to donate to your cause, because I think you give money to people that are really in need, and taking away a little extra elements of stress is good for their health and good for their survival. And that is such a big deal. That's such a beautiful thing. So you guys rock.
You have me tearing up over here.
Oh, I know. I can see the faces of all these women I know that would just, they need a break, and it's so awesome that you guys are out there for that.
We're always here. Anything we can do to help to alleviate that stress, because with that diagnosis, it seems like the world wakes up around you and just want to overload you with everything. Feel stress, kids, anything you can think of, it just all comes just pouring on you. And if we can do anything to help alleviate some of that weight, we'll do it. Yes. All right. So for any of you interested in learning more about My Sister's Keeper, you can reach us on our website, which is www.mysisters.keeper-cle.org, or give us a call at 216-333-1819. You can also join us on Facebook, My Sister's Keeper Cleveland, and we're also on Instagram. We hope you have a wonderful evening, and thank you, Anna, so much. We'll be in touch. You are a new member of our family, so thank you for joining the My Sister's Keeper Cleveland's clan. Lavada, thank you as always. Do you have any closing remarks before we tune off?
Just thank everybody for joining. It's a pleasure to have you. Pleasure to have Anna anytime. And thank you, Mary, for everything that you do.
Hey, this is all you, dear. Thank you. Have a good night, everyone.